There you go. Okay, so we're going to go ahead and get started with today's training. I know it's like the very first call for this mentorship program. We have 8 calls total. So that's 8 weeks. Every week we're going to be meet on the same day, the same time, which is Thursdays at 12 p.m. Central Time for me. And then the goal for these calls is to dive deep into each treatment that we cover inside the program. And then if you have questions along the way, we're going to cover body types, we're going to cover protocols, we're going to cover timing, we're going to cover all of that good stuff. So that way you really understand and really master your technique. Because the goal for this program is for you to become the best, get really really good with your treatments so that you can start charging more for your services, because technically these services shouldn't be charged so low. It should not be charged at 50, 60, $70 per session, because if you think about it, it's it's more like a luxury treatment. You don't need body sculpting. Like, you don't
Hmm.
need it. It's more of like, I want it. You know what I mean? And so it should be seen as that. And the sad part about the body sculpting industry, if you haven't realized it yet, is that people see it as, or people take it as, oh, it's just a little business. It's just body sculpting. It's just like non-invasive treatment. So they see it, or they take it more of like, oh, it should be cheap. Like, they don't really see the value within the treatments. And it's something that I'm really trying to change within this industry, because I feel like a lot of people start or join the body sculpting treatment just to make extra cash. And so because of that, and because of the people training, and offering the trainings, they really only do it for the money. They don't really do it to help you learn and understand and grow your business and grow it the way you should be able to grow it. You know what I mean? And so then we feel stuck. Then we get stuck in like charging 50, 60, $70, and then you're just scared to charge more and grow your business because of the mentality that we're in, the things that we've been taught, the things that we've seen online. And that's really what I'm trying to change, with this mentorship program, because it's very well possible for you to charge 150 $200 $250 for a session. It seems like it's a lot. It may seem like it's a lot, but you can. Again, these are luxury treatments, but at the same time, you're helping people look and feel better. It's not just about them working out, because yes, if they work out, great, it's even better, because they will see much much better results and faster. But it's really also to help women, even men, get rid of like the excess body fat that they're not able to get rid at the gym. Because even women that exercise a lot and they're very fit and they're eat really healthy, they have cellulite. And so this is where these treatments come into play. This is more like a luxury slash kind of like health type of treatment, because you're helping your clients heal from the inside out. But it's also a luxury because technically they don't have to have these treatments to survive. You know what I mean? It's like lashes. You don't have to have lashes to survive. Um it's a luxury treatment, just like nails. What I have right now, it's a luxury. You don't have to have it because you're not going to die without it. And that's the way I see it, and that's why I feel like we are able to charge more for our services. Like, look at permanent makeup. You have tons of people doing permanent makeup, microblading, micro shading, all that stuff. Some people charge $150, other people charge $1,200 for a pair of brows. You know what I mean? What's the difference? Because they understand that this is luxury. You don't need it. You want it, but you don't need it. And so this is something that we really have to like keep in our mind. And I know it can be scary at first to raise your prices. Now, going into the treatments, the very first treatment inside the program is the mommy makeover, which is like on the stomach and sides. Have you watched? Did you watch the videos already for that one? I can't hear you.
I'm sorry. I kind of have been like going like back and forth
In
watching
and
like
out.
certain, yeah, in and out. Like I've watched a few of like the TikTok things. I don't know where or if there's any already on like the community page or like how to find that. Because honestly, it was hard for me to try to get this link because I didn't get an email. Like again, me and my mom put like our emails in there, and she got the link today, and I got yesterday's link. So I was like, "What's going on?" She goes, "I'm like, hang up the phone. I'm gonna log on now, see if anyone's there."
You
So
got yesterday's link. Okay, but yesterday's link, I've uploaded it to the community.
yeah, and what about today's link? Because I didn't get the
Mm,
today's link. She forwarded it to me.
I don't post it in the community because there's people who are like in different programs that are not part of the mentorship program. And so if I
Oh,
post the link in there, everybody's gonna have access to it.
yeah. Okay.
So the way
I was
you
like,
get
why
the
didn't
link,
I get it?
it's inside inside your portal. So you log into your account where
Mm-hmm.
you're able to access the program.
Mm-hmm.
One of the first tabs, it says Zoom links or
Oh
links.
yeah, I saw links. Yeah.
Yeah. And so where it says links, it's going to give you the link to the Zoom call. That's how you
Okay.
access these calls. And it's going to be the same link for, for the duration of the program or the coaching calls, I mean. It's going to be the same link, same password, same everything.
Yeah.
But only those who are inside the mentorship program have access to this link. Now, the
Mm-hmm.
other one that I posted yesterday, because it's for everybody, like
Mm-hmm.
anybody is able to watch it, because I'm not doing like treatment trainings. It's other types of like coaching calls. And so I allow everybody to join. So anybody in the community, anybody on Instagram, anybody on TikTok,
Oh,
anybody on Facebook is able to join.
this
But
is
not
because
these
we pay
calls.
for the membership. Okay.
Yeah, not these. These are reserved for the mentorship
Membership.
program. Okay.
Mm-hmm.
So now the next question is, have you started your business? Have you started treating clients? How's that going for you?
No, I haven't.
No.
I haven't. I don't have a business. I work part-time. I had to give up my corporate job for I have twins on top of an older one. They're both we just found out that they're just ADHD, but for about a few years we are going back and forth with pediatricians and stuff. So I had to give up my 9 to 5 for a part-time job. Our
To
house
take care
caught
of
on
them?
fire. Yeah, our house caught on fire.
Oh God.
Yeah, February. So we just by the grace of God, we kind of just got into permanent housing. And since I'm already doing part-time, I want to like just do something like I'm always been interested in like getting myself together. Like when I feel good about like my outside, my inside kind of forces like you know what I mean? So I feel
Mhm.
like I'm also very given and I'm like a people person, like a people pleaser. So I feel like some kind of like cosmetology, like me and my mom have been talking about like just body sculpting for so much. She has so many like people that because she's an entrepreneur. She's like, why don't you just you're not supposed to be working for no one and you have the minds. And I'm just like, I'm too afraid. So this is my first step into learning everything before I like put my foot in. Because she was like, just do the business. That's the only way you can be forced into doing something. Get out your comfort zone. I'm like, no, let's learn about it first. Like I just want to learn first.
I get it. What kind of
um,
business does she have?
women's
You said she's an
empowerment.
entrepreneur?
Yeah, so she does women's empowerment. She goes to a lot of conventions and stuff.
Oh.
She's really good at like networking. So I just talk a lot. She has
I'm
like
sure you learned a lot from her.
yeah,
Yeah.
she's the best. She has like she started with Muslim Travel Rocks, and then that went on to like a different business. And that from there that went to like a different business, and now she's just like it started with her finding like traveling the at least the United States with people that are like Muslim. And actually, you
Oh,
treated my mom. She just went to Texas. You had like a last
I
minute
know.
cancellation.
Wait, what?
I think she went to Texas for her
What's her
birthday
name?
actually. Glory V. Glory
Gordy?
V. Glory.
Corey.
Glory. Yeah. She was like, you
Glory.
have to go through her. You have to do her mentor. She was like going crazy about you. Glory, she went over there. Her birthday was the 12th. And she was
When?
just
What?
showing me her
Was it like
results.
2 months ago?
No, November.
This month?
Yeah, she went on a last minute trip. She goes, I gotta get out of here. And I was like, okay, have fun. Yeah.
Okay. She took a training or a treatment.
No, she did a treatment with you.
Good Lord, I don't recall that name.
Yeah, I don't know which one she uses. I'll have to ask her though. But yeah, she was like she was really going like, "You should meet her, you should come, we should go over there, I'm gonna fly and get enough treatment." I was like, "Mom." I was like,
What
"Hold
like,
on, let me
what's
learn
happening to
some."
you?
Yeah, but it's been on her mind for a little bit. My mom kinda she'll learn it, she'll study it before she really gets into it, and that's kinda like what I'm trying to do now.
Mhm. Okay. Well,
Mm,
it's really good to know that you are wanting to start something for yourself, and the reason why we start a business is because we want something for ourselves. We want something better for our family. We want to make money. We want to grow. We don't want to stay stuck in the same situation,
mhm,
in the same position that we've been for, whatever long you've been in there. Even me. I mean, I've had two other businesses previously, and obviously they both failed. I worked in the corporate America as well. I've worked the regular 9 to 5 jobs, and at the time, it was okay for me. Not anymore. Now I have kids. That is not okay for me. It's just not. It's not for me. You know what I mean? And so I'm really happy for you, and in just having the support from your mom. It's even a big plus because a lot of us don't have it. A lot
yeah.
of us do not have that when we start our businesses. Jesus, my kids are screaming in the background. Um, Okay, so body sculpting in if you've I'm sure you've done your research, it's all non-surgical treatments. You can achieve results with cavitation, with laser lipo, with radio frequency, with wood therapy. You can achieve it with the EMS. I don't know if you've heard of EMS. It's basically like an electromagnetic muscle stimulator. So that's more for people who want to define the muscles, but it also helps with fat loss. But if you're really trying to help reduce a lot of inches and contour the waistline, mold the body, this is where you use the laser lipo, cavitation, and wood therapy to achieve that. For people who are mainly people who are already training, who are already fit, and they just really want to tone a specific muscle group, they'll go through the EMS type of treatments. They won't really do cavitation because that's not for them. Cavitation is for fat loss, the EMS is more for toning and building muscle. You can combine the two. You can use cavitation, wood therapy, and EMS together to achieve both. But it's a process. You'll see that like the spas that offer EMS are really for, and you'll notice that you'll see the videos, you'll see the before and after pictures. It's really for people who are already fit, who are already training, or for women who just want to tone their glutes, like the muscles on the glutes. Like maybe they're already working out, but they want to tone it a little bit more. They want to lift more muscles on the glutes, so they'll go and get these EMS type of treatments. But for those who are wanting to stick to skin tightening and fat loss, this is where you'll use your wood therapy and your cavitation laser lipo as well. Have you gotten a chance to go through the manual and like the training videos, the fundamentals?
Yeah. Yeah, I went through some of it actually today too, just to go over some things.
I
Actually,
know I know like the fundamentals training goes hand in hand with the manual because I'm literally reading the manual
mhm,
while I recorded that training, and I'm explaining every like page by page, word by
mhm,
word. So if you went through that already, you pretty much have a good understanding of what cavitation is, what laser
mhm.
lipo is, what red light is, the differences between laser lipo and the radio frequency. Are you familiar with that?
Yeah.
Okay. Okay, good. So then we can go ahead and jump on to the next step.
Mhm,
Now, the next step when you are treating someone is understanding their body, following a thorough consultation, understanding their health issues, how it can affect them when you're doing a treatment, and how it cannot affect them, and of course, understanding and seeing their body to achieve the best goals and the best results for that specific client. Because the biggest problem I see here is that a lot of body sculptors they take a training, they start doing treatments, but the first thing they do is like they treat everybody the exact same way.
mhm,
You're not supposed to do it. You're not supposed to do it that way. I said it in a video the other day. It's like you go to a gym, and you hire a personal trainer. That personal trainer is not going to put you to do the same exact workout routine as another person, because you are you and you're there for a specific goal and they are there for another goal. It
Mm,
might be similar, but it's not the same. You know what I mean? So maybe that person needs more fat loss, maybe you need more toning. So the exercises are going to be different, and it goes the same way with body sculpting. Like we have to understand who we're treating, what they're going through, what they want, and how you're going to customize a treatment for that specific person. So the number one when you're going through a consultation is the very first thing is ask about health and medical conditions. Do you
mm,
have any health or medical conditions? Because if you go through the manual, you'll see a list of contraindications. There's a
true.
lot of things that if they have, you cannot do the treatment. Other things that they have, it's case by case. So, for instance, in the manual, if we're talking about the contraindications, if they have any autoimmune disorder, we cannot treat them unless it's like if it's a thyroid disorder, if it's high blood pressure, and if it's diabetes, we're able to treat them, but only if it's controlled. There you go. That's what I was trying to say.
Mm.
Can you hear me?
Yes.
Yeah. Okay. So if it's controlled, let's say you get a client, they say, "Yeah, I do."
Whoa, where'd you go?
It did this
Okay,
same
there you go.
thing.
I was literally
Yeah.
gonna write in the chat, like, wait, what happened? It's
No,
like,
it
did
did
you
the same
like,
thing to
yeah,
me
and I'm like,
yesterday.
wait, what happened?
So the first questions you have to ask is like, is it controlled? If it is controlled, then you have a green light. You're able to proceed with the treatments. Now
What would
with
be
these,
controlled? Like they're getting like work
they're
done, but
on medication for it.
okay.
Yeah,
Okay.
they're on medication and they're not constantly going to the hospital or having to see their doctor because of their condition. Like if they have high blood pressure, maybe it's controlled, maybe they're taking their medication, but they're still constantly having to go to the hospital or to see their doctor
Mhm.
like very often because not even medication is controlling their high blood pressure. Then in that case, we cannot treat the client. Same thing with diabetes, and same thing with a thyroid disorder. I have people who have the thyroid disorder and I'm able to treat them, and I've had other clients who have the thyroid disorder and I'm not able to treat them because one, they're either not on medication, or two, they're having to go to see a doctor very often for their condition. So that's a red flag for me, and I'm like, nope, I'm not
Mhm.
going to treat you because I don't want my treatments to make your condition worse. You know what I mean?
Mhm.
Because then that might fall back on you. And so that's what you want to avoid. But if it's controlled, if everything's good, then you're good to go. You're able to do the treatments. Now, what you need to be aware of is that if you do treatments on clients like them who have thyroid disorder, high blood pressure, or diabetes, they may not see results immediately. It may take them longer for them to see results because of their condition. A thyroid disorder means that it's either one or the other. They are losing weight way too fast or they're not losing weight at all. Majority of the time, people who come in for these fat loss treatments is because if they have a thyroid disorder is because they're not losing the weight.
Mm.
It's obviously they're going to want to get a treatment because they want to lose
Mhm.
the inches that their body is not getting rid of. So we already know that that client is going to have trouble seeing results. I'm not saying it's impossible, but it will be slower. So it's something that you have to let them know. Listen, these treatments work really, really well. But because of your condition, you have a thyroid disorder. I know that your body's not able to lose weight as fast, and because of that, the treatments are not you're not going to see results as quickly as you may want to. I just want to set the expectation from the get-go, so that way they're not here thinking like, oh, these treatments are going to help me lose 5 inches in one session. You know what I
Mhm.
mean? Like,
Mhm.
you got to set the expectation for them, especially if they have these conditions. Same thing goes with diabetes, same thing goes with high blood pressure. The only difference with diabetes though is that these type of clients may bruise really, really easily,
Mhm.
very easily. If they bruise easily, it may take longer for them to heal from that bruise. Their skin may be more sensitive, extremely sensitive. Um, and so we kind of have to be careful with them. When we do these treatments, we're really trying to apply some pressure. It's not excessive. It's not to the point where the client is going to be screaming that they're going to be in pain, but it shouldn't be too light either. Like, there has to be like enough pressure on the skin. So when you're treating a client that has diabetes, and it's controlled, because you're applying pressure, and we're doing friction on the skin. We're literally rubbing the skin with the probe, right?
Mhm.
And with therapy tools. So they can experience more bruising, like, much faster, much faster. And it's normal because of their condition. Um there will be people who do not bruise at all, but when it comes to people who have these type of conditions, yes, they will more than likely bruise really easily. They won't see results as quickly as they would want to. So it's something that you have to let them know, set the expectation, and make them aware of what you're doing, all the things that you're going to be working on them, so that way they know that to not expect drastic results in one session, because there will be clients who you will see like drastic results in one session, but that's because they're probably really healthy. They're already like, they already work out, they eat pretty,
Mhm.
they eat okay, they're not too big, they're excuse me, their body fat is not that hard to break down, because there's different types of body fat. And so these are like the perfect candidates, because they'll be able to see like drastic results in like one session, 1 2 sessions. They'll be able to see like really, really, really good results. But unfortunately, not everybody's like that. Not
Yeah.
everybody responds to the treatments like that, because it really has to do on the type of body fat they have. It has to do on the way they're eating, their lifestyle. It has a lot to do if they're consuming alcohol after the treatments, if they're bloated, if they have visceral fat, if they have any underlying gut conditions like ulcerative colitis. Anything that can cause them to retain fluid and bloat and all of this stuff will 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 cause them to see results slower. You know what I mean?
Mhm.
Question so far?
No.
No.
I'm like
Okay.
going on. Right?
The next set of group would be people who have autoimmune disorder as well, but this is the other group that you just cannot treat. An autoimmune disorder would be someone who has lupus. If they have lupus, forget it. We cannot treat them. That's a an autoimmune disorder that it can be treated, but there's really nothing that the doctors can do. The medication cannot take it away. And you do not want to do treatments on a client with lupus, because you do not know how it's going to affect them. That's one. People who have like severe skin conditions like eczema, psoriasis, all of that stuff. If it's like throughout the whole body, and if it's severe, we cannot treat them, because it may cause the condition to get worse. And then two, you don't want to cross contaminate either. Remember,
Mhm.
you're using one machine for all of your clients. So you're supposed to be sanitizing, cleaning, and disinfecting and sanitizing, but you still don't want to cross contaminate between one and another. So like severe skin conditions, no. Lupus, no. Cancer, no. If they've had cancer the last 6 months, I don't recommend you do a treatment on them. It's too soon. For me, that's too soon. My clients have to be cancer free. I'll treat them. And as well, and also, if it's a cancer free patient from that she's been cancer free for 2 3 years, I would encourage you to ask them for a doctor's form, a doctor's consent form, a doctor's note, something from their doctor, giving them the green light that they're able to do these treatments. Because
Mhm.
again, you don't want anything to fall back on you, and it's really to protect you and your business.
Mhm.
Okay. Um, the other conditions would be like anybody who has a pacemaker. We know that someone who has a pacemaker, we know that their heart is just not functioning at its best. Obviously, they have a pacemaker because the heart needs help. And when
Mhm.
we're doing these treatments, the circulatory system and the lymphatic system, they both work hand in hand when we do a fat loss treatment. And because of that, obviously we need the heart to pump more blood because it runs through the circulatory system as well. So because the heart is not working the way it's supposed to, it and it has a pacemaker, we cannot do the treatments because we're literally causing changes in the body. We're causing the heart to produce more blood flow. We're causing the lymphatic system and the circulatory system to work more in order to help the body flush out. So because of that, the heart needs to pump more blood. And if the heart is already not working at its best and it has a pacemaker, you don't want to cause a heart attack.
Mhm.
You do not. So anybody who has a pacemaker, we cannot do treatments on them. Okay. Um, Other things like what about like the copper IUD? Anybody that has an IUD, anybody that has um, uh, the Nexplanon, which is the birth control that goes on the arm,
Mhm.
you know, that one. What about like the pill? So if they're on any of those, that's fine. Like there's no contraindication to that. You'll probably hear that if someone has the IUD, you cannot do the treatments. What you need to remember is that you cannot do the treatment on the area. You know what I mean? So
Mhm.
I've had some clients, and I'm gonna tell you this. I have some people ask me, you know, I have like a lot of body fat on like right above my crotch,
Mhm.
like where the uterus is.
Mhm.
So it's not the lower belly. So we have
Mhm.
the belly, we have the lower belly, and then we
Mhm.
have like that uterus section, right?
Mhm.
So some people will tell you, and they've told me, like, I have a lot of body fat there. Do you think you can treat that area? I don't do it. For
Mhm.
me, that's a little too risky because we're going right over the uterus, and then
Mhm.
some people have fibroids. And if other people have the copper IUD, we cannot do treatments there. So if they have a copper IUD, if they have fibroids, we just need to avoid that area and really focus just on the stomach, the sides, the back, any other area except that. Now, the one that you really need to really pay attention to is when someone says, I'm on birth control, and you ask them which birth control, and they say, oh, I have the shot.
Mhm.
Do you know which one is the shot? The
Mhm.
depot?
The depot, yeah. Mhm.
Okay. The depot is the shot. That one has so much steroids. So,
Mister,
so
to me, my mom was asking like questions. To me, I just heard a lot of like gaining weight with that. So would that even be a point of like doing treatment?
well, that's the thing. Because because that shot has so much steroids, it causes the client to gain weight.
Mhm.
That's one. The second thing is that they're not able to lose weight because of the shot, because
Mhm.
it has a lot of steroids. Now, steroids is a direct contraindication when you're doing cavitation. Anything that has steroids, you cannot do a treatment. You cannot do a cavitation treatment because it's just going to cause them to swell more, retain more fluid, gain more weight. So instead of actually helping them, you're making it worse. But it's because the shot has a lot of steroids in it. It's
Mhm.
so potent, so strong. So if they're on the pill, that's fine. You can do the treatment. If they have the Nexplanon, that's fine. If they have the IUD, that's fine. But if they take the depot, you cannot do the treatment. So maybe on the consultation, on the Oh my gosh. The consent forms. Maybe on the
Mm,
consent forms, everything seems to be fine. They're healthy, there's no conditions, there's no skin condition, no health condition, no nothing. But if it's a woman, I'm not sure if you're wanting to treat men and women or just women, but if it's a woman and the consent forms is all clear, everything seems good to go. Ask them, are you on birth control? Yes. Okay, which one? Oh, it's the pill. Okay, you're fine. Oh, it's the IUD. Okay, you're fine. Oh, it's the next one on. Okay, you're fine. Uh, I'm taking the shot. Depo. Sorry, I can't do
mhm,
the treatment. So they're gonna ask why. Well, because that shot has a lot of steroids, and steroids is a direct contraindication, and we cannot do the treatment because instead of helping you, you're gonna gain weight. You're gonna get bigger because it's a contraindication. It makes things worse. So that's the only exception. And a lot of people miss this. And so because you don't a lot of people don't ask these questions, you take your client in, you're doing the treatments, and then after one session, two sessions, you have a before and after, and she looks bigger. And you're like,
mhm,
what happened? She's drinking
mhm,
her water, she's running, she's exercising, she's eating better, she's doing all the things, but she's getting bigger. Well, did you ask about birth control? If she's on depot, that is your reason. Now if she's not on depot and she's gaining weight rather than losing, then there's probably another underlying condition that she probably doesn't even know about. Maybe she has like ulcerative colitis that is causing her to swell and retain fluid and look bloated. And maybe she doesn't know it. Ulcerative colitis is like a gut condition, and it causes swelling, it causes inflammation in the gut. So the person looks bloated. She may look like she's pregnant. Um, and so sometimes we'll offer or sometimes we'll have them like do a detox at home, whatever kind of detox, whether it's smoothie, juicing, or teas, whatever kind of detox. We'll have them flush out at home. It looks better, you do the treatments, but then it looks like they're gaining weight. Something is going on with their body. If they're gaining weight and you're doing everything that you possibly can to help them lose the inches, it means that something is going on with their body that they probably do not know. Maybe they're taking, I don't know, some sort of medication. It could be that they have asthma.
mm,
If they have asthma and they use, there's a specific medication for asthma. And that one I know because my son used to take it.
mhm.
He went from Flovent, then no, he went from albuterol. Then he went to Flovent, and then the other one is called Jesus. Hold on, let me see. Um, no, it's not here. There's another one. It's not the nebulizer. Symbicort. So Symbicort has a lot. It's very potent as well with steroids. So if maybe she's super healthy, there's nothing else going on with her, but she has asthma. So then you ask, okay, what type of medication are you taking? And she says it's Flovent. How often? Well, I'm my doctor said that I need to take it every single day, like forever, for 6 months, for 1 year, whatever time period, but I have to take it every day. That one is very similar to the depot. It has a
Mm,
lot of steroids. So what's going to happen, because steroids is a contraindication, then that's probably the reason why you're not seeing results on that client. So this is where this is why it's really important to do a thorough consultation and ask all of these questions, because a lot of times people might hide it from you. They won't tell you because they really want to get the treatment done, you know?
mhm,
Um I'm going to tell you something that happened to me like a couple of weeks ago, 2, 3 weeks ago. I had a client, she filled out her paperwork, everything seemed good. I asked about birth control, I asked about asthma, I asked about any underlying condition, any medication. I asked everything that you could possibly imagine. She said no to everything. Her consent forms were clear. Sure enough, she came in back to back. The first three treatments, they went great. She was losing the inches, not as quickly as we wanted to, but she was losing the inches. The
Mm.
fourth session, after that fourth session, she blew up. So I looked at the pictures and I'm like,
What happened?
what happened? Yeah, I asked her like, are you going out? Like, are you drinking? Are you eating more? Are you eating fast food? Are you eating late? What
Mhm,
happened? And she's like, no, I'm doing everything that I can. Like, I'm working out. Like, I exercise every day. I eat really clean. I drink a ton of water. Blah blah. And so I showed her the pictures. I'm like, this is the first one, this is the third one, and this is this one that
mm,
we did right now. You're bigger. Why? What happened? Like, is there something going on with you? Like, do you have asthma? No. Like, do you have this? No. Do you have any gut issues? No. Blah. And so ultimately, she told me, well, I've been to different doctors several times, and they told me that I have an autoimmune disorder. And I'm like, okay,
mm,
which one? She said, well, that's the thing. They cannot figure out which autoimmune disorder I have, and anything that I do, whatever I do, I cannot seem to lose weight. And the little bit of weight that I lose, I gain it back and I swell even more. And I'm like,
mm,
and you're just now telling me. She was
mhm,
really keeping it to herself because she wanted to try the treatments. Then she came and told me, well, I've tried cryotherapy before and it didn't work. I blew up afterwards. I
mm.
tried red light therapy, it didn't work. And I'm like, oh my God.
There's a reason.
There's a
Mm,
reason for it. Like, if you know your doctor told you have an autoimmune disorder and you know your body very well, you know that you've tried other methods, it hasn't worked, you should have told me this in the first place. I could have saved you this money
mhm,
because she was paying a la carte. She was paying the
mm,
treatments as needed. So she didn't buy a package. She was like, I want to just pay whenever I can, whenever I come in. So she was coming in once a week. And so for the treatment that she was getting, sometimes she was getting the stomach and sides. The other treatments she got stomach, sides, and back. So, she paid at least a good $1,000 for her treatments, for
mhm,
those four treatments, right? But I'm like, y- you could have saved this money um, if you would have been honest with me. Because I'm
mhm,
telling you, like, I go through my consultation because I really want to make sure that I'm going to be able to help my client. Not everybody is a good candidate for my services. Not
mhm,
everybody. Majority of them are, but when I come across these conditions, I tell them, nope, I'm sorry, I cannot because of this, and that. And so this is why I tell everybody, do a thorough consultation, ask all the questions. Like, if you did your best, that's not on you. If they
mhm,
kept it from you, it's not on you. That's it's not your responsibility. You do the best that you can, and that's it. So when you do a thorough consultation, make sure you ask all these questions, go through the manual again, go through the contraindications. There's other contraindications, for instance, um people who have like chemical peels, permanent makeup, like tanning, stuff like that, they are able to get these treatments.
yeah,
Especially now, we're moving on to treatments on the face. Okay,
okay,
let's say it's someone who's coming in for a skin tightening treatment on the face because they want to reduce the appearance of fine lines and wrinkles. They want to tighten the skin, right? If they recently had a chemical peel or Botox, they have to wait. They have to wait at least a good 2 weeks before they get a radio frequency treatment. Why? First of all, radio frequency heats the skin. It forces the skin to produce collagen, right? And so because of that, because it's heating the skin, it can cause more sensitivity on the skin. So if someone has, let's say, a chemical peel, we already know that a chemical peel, they're literally removing all the dead skin cells. They're doing all these things on the face, on the skin. And then you come in and do a radio frequency, skin is already sensitive. And when you apply heat, to that sensitive skin, it's just gonna feel like it's burning them. So you can cause like heat rashes as well. They may feel like extra sensitive on their skin as well. So that's why we have to wait it out. Like it's not that you can't do the treatment, they just have to wait. So they either get it done before the radio frequency or they get it done afterwards. You know, that's for any type of facials that they want to do. It's either before or afterwards, but not during, not right before the treatment. Okay, these are things to like, it's really just to protect the skin because radio frequency does cause sensitivity, extreme sensitivity. Like me, when I've done the radio frequency on my face, like I'm not able to touch the upper part of my face, like my forehead, like this section right here. I cannot touch it because it feels extremely sensitive. It feels like I'm bruised. That's how
Mhm.
it feels, but it's because of the radio frequency. It's because of the heat. It's producing a lot of heat on the skin, and so it's forcing the skin to produce collagen, and that radio frequency causes skin sensitivity. So that's what happens to me personally. Like I'm able to touch here and I'm okay, but if I touch my forehead after one of those treatments, it feels like it's bruised, and it takes about a week. For me, it takes about a week before my skin goes back to normal. So that's what I'm
Mm.
saying. If anybody wants to get a skin tightening treatment on the face, they have to wait. So they do it before, at least a couple weeks before, or they do it a couple weeks after. Okay. These are things to be aware of um, right now because we're kind of going over like contraindications. So there's things that you can do. There's things that there's conditions that you just cannot. You just cannot treat your client with those conditions. Any questions so far?
No.
No.
Well, we were like, I take notes and reread, and well, I'm going on my second page now. But I kind of read most of this on the sorry, I do. I'm a note taker. I kind of went over like most or some of these in like I think it was the manual.
hmm So like those fundamentals, the fundamentals training videos, I go over all of this as well. Like I
Mhm.
literally go over the whole manual completely. Um, that's what the fundamentals is. It's because like I really want you to have a good understanding of body sculpting, of the treatments, of the machines, and all of that stuff, so that way you know how to treat your client. Okay. Now, before we end the call, we have about 10 more minutes. I'm going to show you. Uh, I'm going to show you something. 1 second. I'm looking for. Okay, so I'm going to go ahead and share my screen, entire screen. Okay, so let's look at some bodies. Okay, so I have this picture right here. If you look at her, she has almost no body fat. This one, can you see my screen?
Yeah, sorry.
Okay. Then we have this one right here. She has a little bit more, a little bit more, all the way to someone who has about 45% of body fat.
Hmm.
Now, when you are about to start a treatment, what you need to look at, especially, we're going to talk about the stomach and the sides, okay? When you're about to do a mommy makeover on the stomach and sides, you really have to look at the body. You got to look at the stomach, look at the sides, because sometimes people may have like a bigger bulge on the lower belly, and then they may be flat from the top and then a big bulge on the lower belly, or it could be a double bulge on the top and the bottom, and then they have like literally no rolls, no muffin
Hmm.
top, or they could have a bulge in the front and then one side is larger and then the other side is smaller. So when you
Mhm.
look at your client and you see that she's kind of like lopsided, one side is bigger than the other side, and then the stomach, one side is bigger than the other side, we have to remember that our goal is to help them reduce body fat. So we have to spend more time and focus on those areas where they have more body fat. Because the first one or two sessions is really about making everything look even. So let's say she's lopsided. She has one side is bigger than the other. The first and second session is really about reducing this side as much as you can to make it look even to the other side. And the same thing with the front of the belly. You know, the goal is fat loss, a lot of fat loss. How do you achieve that? Laser lipo pads. Of course, they have to be the 160 mw, not the 5 mw. Cavitation, wood therapy. Those are the three main things that you're going to use in your body sculpting business when you're offering a treatment to your clients. So, for instance, someone like, um, let's say, someone like her. I'm gonna make the screen bigger. Come on. So someone like her, you look at her, you're like, she's thin, she's fit, she looks like she's exercising a little bit. She doesn't have a lot of like large muscle groups, but she's thin, right? We see that she has just a little bit of belly fat here, not a lot on her sides, but we can still work on the sides to make it look like the one right next to it. Because we
Mhm.
want to mold, we want to contour, like create that waistline. You know what I mean? So on someone like her, you're really just going to focus on this midsection right around the belly button and, of course, the sides. Like, that's the goal because there's really not much to work with. If you
Mhm.
start doing treatment on the upper part of the belly, mm, it's not going to be much of a difference. So, focus on the area where she has the most. Even though she doesn't have a lot, you can tell that most of her belly fat is right around the belly button. And then we can use the wood tools to mold the waistline to make it look like this. You know what I mean? Oops. Now let's look at somebody else. Now we're looking at her, someone who has a lot more body fat. We know that she doesn't work out. We already know she doesn't work out. She probably walks, but she does not work out and she's hasn't been eating that healthy. So obviously, we got to work with her. We have a lot more to work with. Um, Something I forgot to mention here is someone like her, she really only needs like one, two sessions. Any more than that, it's not needed. Like, it's not needed because she has very little body fat. And so 6 sessions for her is way too much. It's just way too much. So 1 to 2 treatments maximum is really what she's going to need. Now, for her, for sure, we're going to need at least 3, 4, maybe 6 sessions, depending on her conditions, depending on her health, depending if she doesn't have any thyroid disorder, uh, diabetes, high blood pressure, depending how well she takes care of herself at home after the treatment. So it could be anywhere between 3 and 6 sessions. More with 3 sessions, you can absolutely definitely help her reduce a lot of body fat. So someone like her, we see that she has body fat all around. It's all
Mhm.
around. Can you see me? Yes.
Mhm.
Okay. We can see that it's all around. The lower part is bigger, but she still has body fat on her upper belly. Compared to her, she has nothing here. So there's really nothing to work with here. So the goal is sides and lower belly. Now with her, it you would have to work on the whole belly and the whole sides because there's body fat there. So when you're looking at her, we say, okay, she's not lopsided. Both sides look even. Yes, she's larger, but they look even. It's not like one side is bigger than the other one. You know what I mean?
Mhm.
When we look at the belly, we see that the lower belly seems to be bigger. Okay. So what I typically like to do on clients like her, because I see that the lower part of her stomach is bigger, even this, Jesus Christ, even the sides are bigger than what I do on like the very first session, first maybe 1 2 sessions. I will focus more on this lower part. I'm still going to target the upper part. I'm still going to
Mhm.
target the sides, on the upper part of her sides, but majority of my time is going to be on the lower belly. And my goal here is strictly fat loss. I'm not worried about skin tightening right now. Right now it's all about shrinking. It's all about reducing the inches. It's all about helping her get rid of as much body fat as possible. Once I achieve that, then I'll start adding the skin tightening. You know what I mean? Because
Mhm.
if I try to do everything in one session, it's just not going to be enough time. Like, it's not going to give me enough time to do enough of the fat loss and enough skin tightening. So I have to customize it. I have to change it. I have to split it. So my
Mhm.
first session and maybe even second session, it's all about fat loss. Laser lipo, wood therapy, cavitation. Laser lipo, wood therapy, cavitation. Focusing more on the lower part of her belly and her sides, still targeting the upper part, but majority of the time is going to be here, right here, because that's where the reason why I want to focus there is because the more she loses there, the better the results will be. Like visually, she's going to be able to see drastic changes with like 1 or 2 treatments versus trying to compact everything into one session and add skin tightening as well. You're not going to see too much of the results because you're trying to just squish everything together. You know what I mean? So you got to
Mhm.
split it. Take your time. This is good, especially when a client purchases a package from you. If
Mhm.
let's say she bought a package of 6 sessions, well, we know that we have 6 sessions to achieve the best results that we can for this client. So I'm gonna use my first 2 sessions to strictly do fat loss, and then on the third session I'll add skin tightening. The fourth session I'll add skin tightening, and then the last 2 sessions it might be one only fat loss, the other one fat loss and skin tightening. So I'll mix it up like that so that way I'm able to achieve everything, but I'm able to focus on specific areas at a time to really help her get rid of as much body fat as possible. Now, of course, her part after the treatment is to drink her water, to at least go on a walk. If she's not exercising at all, that's what I tell my clients. If you're not exercising and you really do not see yourself like you want to go to the gym and exercise, at least walk for 30 minutes. Just walk.
Mhm.
That's all you need. Drink your water, walk, avoid alcohol, avoid all these fast foods. At least while you're doing these treatments, avoid all of that because you're going to have to come in once a week, and so you cannot have alcohol for 2 to 3 days after the treatment and 2 to 3 days prior to the treatment. So technically, you can't drink alcohol. While you're
Mhm.
on these treatments, you cannot drink alcohol. Is because and the reason for that is because like the body will prioritize alcohol and it'll try to flush the alcohol out of your body because it's toxic, right? And what happens is that what we worked on will just stay accumulated in your body, and so the body's not going to flush it out because it's flushing out the alcohol. So what does that mean? That you're not going to see results. They're going to be very, very, very minimal. So that's why they have to avoid alcohol, drink a ton of water, walk. Those are like the main 3 things that I focus on a lot. When it comes to eating, I tell them do your best to eat better. Avoid fast food, avoid fried food, like super greasy food, avoid it at all costs. Just try your best, but the most important thing here is to drink your water, avoid alcohol, and walk. That's it. That's the main goal. If she's bloated, obviously she's gonna need to detox and all of that, but we'll talk about it on the next call. We'll go over more body types on the next call, the different areas on the next call as well, because as you can tell, it's a lot of information here.
Mhm.
But this is how I would treat this client right here. Okay,
Mhm.
now if it's her, it would be very kind of similar, but with her because she has less body fat, I can add skin tightening on her skin if needed. But it doesn't seem like she needs skin tightening because her skin is not stretched out as much as her,
She looks more
and
firm. Mm-hmm.
it's more firm. So she really
Mm-hmm.
doesn't need a lot of skin tightening. The focus here would be more fat loss and just a little bit of skin tightening. With
Mm-hmm.
her, because it's stretched out more because of the amount of body fat she has, when we reduce that body fat, that extra skin is just gonna hang. That's why she needs more skin tightening than her.
Mm-hmm.
You get me?
Mm-hmm.
So not everybody needs skin tightening. Not everybody. Now,
Mm-hmm.
if we go back to the first one, she doesn't need skin tightening at all. Like, don't waste your time on doing skin tightening on her because she needed. Not unless you see like not unless she's had multiple babies and you see like her skin is kind of
Mm-hmm.
loose just on that middle section, then yes, we can add skin tightening just on that section. But if it's someone like her, like identical to her, and her body is just like that, we don't need to add skin tightening. Don't waste your time trying to tighten the skin because it's really not going to make a difference. It's not. Now, with her, with the pink bra, it will make a difference because her skin is more stretched out. So we need to tighten the skin at the same time that she's losing the
Just
body fat.
losing it. Mm-hmm.
With her, she needs a little bit, not as much. It's like right in the middle. You can get away with your first 3 sessions without skin tightening, and then after that, you may notice that her skin probably feels softer, a little more saggy, just a little bit. So you'll add skin tightening, but she doesn't need it as much. Okay. This is why I say not you cannot do the treatments the exact same way with everybody because everybody is different, and the way you're going to give your clients like the really good results is when you understand their body, their needs, and then you're able to customize according to their needs. You know what I
Mm-hmm.
mean? And this is how you're going to be able to offer your clients amazing results in less treatments. Because a lot of people, because they follow the same protocol for everybody, it takes
Mm-hmm.
them 10, 12 sessions in order for a client to reduce a few inches, a couple inches.
Mm-hmm.
You know what I mean? Like it literally takes them that long, but it's because they're not understanding the body. They're not customizing according to their needs. And so this is exactly what the program is for, to really teach you and show you how to do that so that you're able to offer really good results to your clients with less time so that you're able to charge more. And another reason why a lot of body sculptors charge 50, $60 per session is because they know that it takes them 12 sessions um to achieve like a difference, some results. And so they don't feel confident enough to charge more because they're like, man, it takes me 10 sessions to help her lose 4 inches. When if you understand the body and you understand what they need, you're going to be able to achieve that much inch loss in 3 sessions maybe.
Mm-hmm.
So because of that, because of what you're able to do, you feel really confident in your work, and so then you're able to charge more. You're like $50 for a session that I know that I'm going to be able to help her achieve this in like 3 4 sessions. No, like no, I'm going to need to charge more for my
More.
services because you're confident in your work. You know what you're able to do for your client. You know what I mean?
Mm-hmm.
Okie dokie. So, before I end the call, do you have any questions?
No, ma'am.
No?
No.
Okay.
I
So,
didn't think I would
next,
be this confident, to be honest. I was like so nervous, like I don't know what I'm doing, what's going on. But like going over like just like even like the body types and stuff with you before like you can say it, I'm already like thinking, and I was kind of like right on point with a lot of things. But I want to say that's only because I personally lost 100 pounds by myself. So like all the firming and losing weight and tightening at the same time, that was my regret because I lost all the weight and then I was like, shit, I'm getting saggy. Let me start weight training. So I can like now like when I'm looking at my friends because we go to the gym and still stuff, I'm like, you got some firm fat, and I'm so jealous because their fat is like firm and just like night. It's like, and I'm just like, I don't know. So like
Yeah.
going through like the actual losing weight and toning and the saggy skin like process of me going through it, being able to like look at other people, I kind of like am easier. Like, okay, this is kind of because I'll be at the gym like I can help you with that, do some of that, like you know what I mean. So I feel like this, in a way, kind of goes like hand in hand.
Hmm.
Um, I'm sorry, I didn't think I would be this like I was a little skeptical. I was like, Mom, come on, like really, me doing this, like.
Hmm.
But I feel a little more confident now going through this right here, actually, because I missed yesterday. I was like, what the hell?
Yeah, exactly. So like once you learn all of these things, you're like, man, like I know what I'm doing. Like I know how to
Mhm.
hold the probe, I know how to move the probe, I know how much time I need to do for each client, I know what she needs. And so you're able to give your clients really good results. Really, really good results. And let me see if I can yeah, pictures. Okay, so
I'm
you
sorry. I
see, I'm
left
gonna
the door open. Good one. I left the door open. I'm over here shivering in the house. I don't know why I got the blankets
okay.
everywhere.
So if you look at this before and after, this was after one session, and to me, there's a difference, but it's not drastic.
Hmm.
There's a difference, but it's not like, oh my god, I could have done better. But this was like a client who I treated her, I don't know, maybe like a good 3 years ago, maybe. Yeah, about 3 years, 2.5, 3 years ago. So these were my results in the beginning. It was worse when I first started. It was worse than that. Then now and then you see these results.
Wait, I didn't see the first. I didn't see any of them.
No?
I just see you, which you're very pretty. You look like my sister. I was telling her, I was like, don't she look like Jasmine? She goes, what? I was like, she looks just like your daughter, lady. She goes, I have to go back and look. So I cracking. I was like, you look just like my sister and my little cousin, like literally
Really?
combined. Girl, if I showed you the picture, I was like, this isn't weird to you. You look like I'm looking like I'm looking at my sister. She goes, no.
Okay. Look, this is the first picture. So
Yeah,
you
you can
can
see
see
that.
the difference.
Hmm.
You can see the difference, but it's not that good. Then you see this.
Mm.
So the first one, where is it? Mm, the first one was after one treatment. That was like immediately after one treatment. I could have done better. I could have done way better than that. I'm gonna show. Let me see if I still have.
Do you remember what treatment? Like,
Um,
what do you mean? Like, you could have done better? Like a different like treatment on her?
better protocol.
Mm,
Like I could have customized the treatment better for her to help her achieve more results within that one session.
mm.
I don't think I have the very first one. Do I? No, no, no. So you look at this other one, you can see some changes. This was after 3 sessions.
Yeah, but
You
that
can
looks like a
see,
big difference.
yes. Now we go back to this one. Hold on. We go back to. Nope. Did I close it? We go back to this one. This was after 3 sessions too.
Mm. That was a really good, nice one though.
So you see, three
Hmm.
sessions
3 sessions each. Okay,
and three
I see the
sessions.
difference.
You see the difference in three
Yeah.
sessions.
Hmm.
And it's because I started understanding the different bodies and I started understanding how to customize the treatments for different people.
Hmm.
You're going to get a group of people who look exactly like her. So you're like, you're going to, when you see them, you're like, I already know how to treat. I already know her
Mhm.
body. I know how to treat her. Then you're gonna get a different group of people like her, and you're gonna be like, okay, she seems like her skin is a little bit tougher.
Mhm.
Her body fat is a little bit harder to work with, so I need to approach her differently. So this group
Mhm.
of people, when you look at her, you're gonna be like, okay, I cannot do this, but I need to do this, and we're gonna go over that during our calls. But first, it's like we have to have a good understanding of the different body types and the different body fat and how to approach each one. And that's why you have those videos inside the program as well, so that you go through like the body type videos, the fundamentals, the manual, so that you have a better understanding. So when we come and do these calls, and then you start practicing your treatments on your models or your clients or even your mom, you'll
Mhm.
know how to approach them. You know what I mean? So
Mhm.
that's what I'm saying. When you learn to customize, when you learn to understand the bodies, um, right from the get go. Like the moment you look at them, you're like, I know what she needs. This is how I'm going to approach her. Okay. So we're
Mhm.
going to go ahead and end this call for today, and we'll meet again next week, Thursday, same time. Okay. I don't know if other people will be joining. If not, that's fine. I'm still going to record, I'm still going to go through it. And if you have any questions from here, there, you can always ask them inside the community, or you can just wait it out until next Thursday.
Okay.
Okay.
Yep.
Alrighty. Well, thank you,
Alright.
Cassandra, for joining. I hope you have a good day.
So you too. Okay.
Bye.
Thank you so much. Have a good one. Bye bye.
You too.